So a little advice for those of you scoring this at home. The White House has repeatedly and falsely bragged it has the votes for another House try-it, repeal, and replace. But this week just might be different. House Republican leadership sources are telling CNN they're still short the votes needed for passage, but say there is a desire to try again and that maybe, just maybe, it could happen this week. Really?
They're going to try. The problem is the recess next week in the House. The leadership is nervous about sending their members home to get screamed at.
Didn't they just have a 2-week recess?
They did, and they're having a 1-week recess in the House. So they want to try to see if they can build towards this momentum on this deal that was cut between one member of the Tuesday group, that moderate conference, and the support now from that very conservative House Freedom Caucus. Now, they may be able to squeak it through. It's still going to be very close. We don't know where a number of the members are. Paul Ryan was on the phone this weekend trying to lock down support. The question is, though, even if it does pass the House, what its future is, because in the Senate there are a lot of issues, including procedural issues, because they're trying to use a budget mechanism, and some of these measures that are in the bill will run afoul of the rules in the Senate, and then how do they reconcile in the House and Senate? This is a long way to go from becoming law, even if they were successful this week.
It also doesn't help when you hear what the president is saying, that pre-existing conditions are in this bill. They're not.
Let's play it. Let's play it. The president did a long interview with John Dickerson of CBS Face the Nation, and I want you to listen to this exchange. Part of it is hard to follow because there are interruptions back and forth. It's part of the president's interviewing style. But listen to what he's saying. If you have a pre-existing condition, if you now get guaranteed coverage under Obamacare, if they change it, will you keep it?
Pre-existing conditions are in the bill. And I mandated, I said it has to be.
And one of the fixes that was discussed pre-existing was optional for the states.
Sure, in one of the fixes, and they're changing it and changing
so it'd be
it.
permanent.
Of course.
Okay.
This
That's a development, sir. Crucial question. It's not going to be left up to the states. Everybody gets pre-existing no matter where they live.
No, but the states are also going to have a lot to do with it, because we ultimately want to get it back down to the states. The state is going to be in a much better position to take care because it's smaller.
So I'm not hearing you, Mr. President, say there's a guarantee of pre-existing conditions.
We actually have a clause that guarantees.
Okay, he says we have a clause that guarantees. Before you jump in, Charlie Dent is a moderate member from Pennsylvania who's been part of this. He can't support the deal being brokered. He can't support it because...
All I can tell you is the amendment that has been offered does weaken protections for people with pre-existing conditions because states will be able to opt out or waive out of it. So I think that is a very big concern for many of the center-right members with whom I'm affiliated with.
So the question then becomes, does the president not know what's in this legislation, or is the president selling us snake oil?
Well, he's right that that is one of the things that are being discussed is the waivers for pre-existing conditions. Unfortunately, that's what they're talking about passing as the bill. Right. So to send to the Senate.
That's how they got the House.
That's how they got the Freedom Caucus on board.
The issue here, just so people understand, is that it's not just if you're already sick in this country, the question is not just can you get insurance, but at what price. Right. And under this amendment that is being considered, what got the conservatives on board is states would have the option of essentially saying, hey, insurance companies, you can charge people whatever they want. Right. And that goes much back closer to where we were before the Affordable Care Act, where essentially you would, if you had a hangnail or acne or anything, even minor things, you could either be denied or be charged very, very high rates. So I think that it's kind of disturbing either way for the president, either he not to know or to lie about it. Either way is kind of a problem.